Hello guys, I hope you're having a fantastic week. It is Friday afternoon, so of course I've got to show up and give you all some education. I'm Dr. Greer. I'm a board certified plastic surgeon in Cleveland, so if you haven't met me, welcome. I'm glad you're watching today. Today I want to talk a little bit about spider veins, right? Those are the little broken capillaries that you may get along the sides of your nose or even on your cheeks or on your chin. They're really annoying. So what causes broken capillaries? There are a few different things that cause them. Aging is one of those things that causes everything, right? We can blame aging on everything. So you'll get broken capillaries as you get older. And word to the wise, they're not broken. They're called broken blood vessels because that's what they look like. They're actually just little telangiectasias, or angiomas are the medical terms for them. They're basically just little capillaries that are closer to the surface of your skin. Honestly, my 4-year-old has them. They're physiologic. They are normal, but you will see more of them as you get older. So age is one thing. Sun damage can cause them. Chronically sun damaged skin will have more capillaries visible. Rosacea is another big one. Rosacea is a condition of the skin where you get some inflammation and flushing and redness. My lighting's kind of weird in here. There, I hope that's better for you guys. Where you get flushing and redness, we think it's acted by submicroscopic skin mites that live on your skin and cause irritation. So if you have rosacea, make sure you're seeing a plastic surgeon or a dermatologist to treat that, because good treatment at the get-go can prevent some of the long-term issues like broken capillaries or even rhinophyma, where you see thickening of the skin on the nose. If you've seen people with like the big bulbous nose, that's a long-term complication from rosacea. And just general trauma can cause broken capillaries or telangiectasias too. So if you have a cut on your skin, or I've seen them form around scars, like if I take off a skin cancer, or even after facelifts. So they're really, really common. Most people have them if you look closely around their nose. And the great news is they're really, really easy to treat. So on the legs, we'll often inject them, but in the face, we use a laser. And it's very, very effective. It actually just heats up the blood inside the blood vessel, so it scars the vessel shut, and then your body breaks it down. It feels like a little rubber band snap. We blow cold air at the area to keep it comfortable, but it's not that bad. I've treated the ones in my face, and we treat a ton of patients with that. It's honestly a super fun procedure for me because I get to trace out each little blood vessel and just watch it like disappear with the laser flash. It's so fun. So we often do that alone, or we'll do laser vein treatment as part of a photofacial, which addresses brown spots and wrinkles as well. And the way my office works, we just charge by time because everybody's got a different amount, and it might take me 10 minutes on one person and a half hour on another person. So we charge by time, and what you do is you come in, we put numbing cream on the area because that helps a little bit. Let that kick in for about 10 minutes, and then I'll trace out all the little red spider veins with the laser. And afterward, it's unusual. Once in a while, people might have a little scab. That's uncommon. It is common to have some bruising, though, so be aware that that can happen. And you'll see probably a 90% improvement round with the laser. I do recommend most people come in twice because that first round will get the bulk of it, and then the second round will clean up any little lasting spider veins or redness. And then you probably won't need another treatment again for several years. I have some people that I treated, 5 years ago, and they're just starting to come in with a couple new spider veins. So if you have little red spider veins on your chin or your nose, they're super easy to treat. It's an outpatient. You can do it on your lunchtime kind of procedure. I do offer free consultations for those too. So feel free to call us 440-974-8577, or you can check out the website greerplastics.com. And we'd be happy to see you. I love treating those. Like I said, it's one of my favorite things. Now, if I could just get my husband in here and do his, but he won't let me touch him with my laser. There's clearly a level of trust there. Anyway, thank you guys for joining me. I'll be back next Friday. And if you have any questions, or are there any topics you want to hear about on our Facebook Live videos, jet me a message on Facebook. You can find me on Instagram at Jennifer Greer MD, all one word, no punctuation. And we also do post requests for questions, usually Wednesday and Thursday every week. My assistant Rachel will post those. Or you can leave a comment on our page. We love hearing from you. Thanks for joining me today, and I hope you have a fantastic weekend.